We are covering once again this microanatomy of the GI system, and we have covered this salivary gland, we have covered this esophagus, we have covered tongue, stomach, intestine, small intestine. We are going to take care of this large intestine. Just like the architecture of this GI tube have, it also have the four same layers, like from inside out, like mucosa, submucosa, then muscle layer, and this externa, which is serous layer. Now out here you see that this particular large intestine have a this particular feature we call them as Tenia Coli, which is a band of muscle fibers. Having a band of muscle fibers, this particular muscle layer or muscular externa, which is having thick and tough layer. And on the outer side you see that this is like a fat pouches are there, we call them as Tenia Epiploicae, which are feature of this large intestine. This Tenia Epiploicae present on the serous layer. So it's kind of fats which may be seen in the serous outer layer. And other than this particular having same layer, like a inner side mucosa having got same thing, epithelium, lamina propria, and then we have this particular muscularis mucosae. The muscularis mucosae may be thin, breached out in some of the places that we have discussed before as well. The submucous layer having got collagen tissues, glands not much present. And muscle layer, as I am saying, it is a little bit reinforced, or extra layers of the muscles may be seen, and serous layer, which is may have some kind of fat coats on it because of the Tenia Epiploicae. And this starts from this particular ileocecal junctions. We have this vermiform appendix. We have this particular like vermiform appendix as a specimen for the large intestine. We do not have these large intestine specimens like large intestine composed of the cecum. In this part we call them as colon, we call them as a climbing colon or ascending colon. Then you have a bend, we call them as flexion or flexure. It is related to the liver, we call them as hepatic flexure. Then it is running transversely, we call them as transverse colon. Then it is going on the spleen side, we call them as splenic flexure, splenic bend. Then it descends down, we call them as descending colon. Then it curves over here, we call them as sigmoid, looks like a S, sigmoid colon, and then rectum, dilated part, and anal canal. These are the components of this large intestine that we are seeing. Now this vermiform appendix, which you are going to focus in here, we have got like a collections of the lymph nodes which is present in it, just like is seen over here. The hallmark of this particular region is that it looks like a gut, but it do not have this particular intestinal villi that we have seen in case of small intestine. The villi are absent in this particular region. The villi are absent, rest of the features are there. It has a mucosa which have got epithelium, which have got a single layer of epithelium which is columnar kind of epithelium, and we are going to see plenty of like goblet cells or mucus secreting cells are there. So the goblet cells are plentifully seen in this particular mucosal layer. Then we have the lamina propria, which holds kind of glands, which is like a lift or liver cord that we have seen in the small intestine. This particular region also have glands, which is not that deep, but we have some kind of glands, we call them as mucosal gland, which is running into this particular lamina propria. And then we have this muscularis mucosae. Sometimes or many times we see that it is breached, it is not a continuous just like it used to be before. Then we have the submucous layer, do not have any glands or whatsoever, and this particular submucous coat as we are seeing here having a lot of collagen fibers. It is kind of like a fibers are more there, it is kind of like a dense and rigid. And then we have the muscle layer, inner circular, outer longitudinal, same, which is a little bit reinforced over there. And then serous coat may have this particular same fatty layers that we are seeing here because of the Tenia Epiploicae. And this particular large intestine, you see that looks like a little bit like a bend or kind of like a little bit have saccules like this. We call them Sacculations. So these three features are there for the gross feature of this large intestine. This Tenia band over there, muscle band. Then we have this Tenia this epiploicae over which is present over there, and then we have this particular bend over there, we call them a sacculation, which is kind of feature for this particular large intestine. So this particular large intestine mucosa, which is not having any kind of elevations, bulge like used to have like projections. So absence of the villi, then we have these glands may be simple tubular. This mucosa is lined by this particular columnar kind of epithelium, interspaced by a lot of goblet mucus secreting cells. And then we have this particular lamina propria, which is quite dense, which is going down, and then muscularis mucosae limiting there, then you have submucosa, tough, no glands, nothing there, and outside serous layer which may have fat coating there. So, this is in general over there, that the feature is that looks like intestine having forecoat, but absence of villi and presence of mucosa, lot of goblet cells which is present. So, this is how these particular things are placed over there. It should be large intestine should be placed like this. A lot of like white dots are there because of the secretions of the goblet cells, they are plentifully seen. And then we have this particular breached muscularis mucosae, then we have this particular submucosa which is having tough like fibers, collagen fibers are there. Then muscle layer and this Tenia Epiploicae may be there, which is there. But our point of concern is that we are going to talk about this particular appendix, which is kind of like a vestigial organ which is present between this junction between this cecum and the colon, which is cecum and ileum, ileocecal junctions, which is having a tube like structures having a length of like a 9 centimeter roughly, have got parts like tip, base, apex, tip, base and the body. And this particular appendix like have a lot of lymph nodes present inside. So, lining epithelium on this particular mucosa is columnar, simple columnar, one thing may have like brush borders. Goblet cells are there which is present in this particular region. Lamina propria, this feature which is kind of important here, the lamina propria of this appendix is occupied by the lymphatics or lymph nodes, and these lymph nodes may not be present in the lamina propria itself, maybe just like going down to the like a submucous layer as well. So, this lamina propria, just like that we learned about this particular Pear's patch in this ileum, this also have got lymphatic nodules, but only thing which segregates from ileum from the appendix is that the absence of villi. So, absence of villi with this particular like lymphatic aggregates in the lamina propria and like a simple columnar kind of epithelium with the goblet cells, these are kind of like hallmarks which are going to see. So, mucosa having got this feature, lining epithelium, lamina propria, having lymphatic nodules, and these lymphatic nodules may encroach into the submucosa because this muscularis mucosae is not very tough and present. So, roughly it looks like this lumen, the lumen may have an angular look, like looks like an cottage because of the small tube size, and this particular lumen. After that, then we have this particular layer which is a mucus layer, which is mucus layer, single layer of this columnar cells which is present, and you see that this is bend over there, which is kind of like a glands which is going into the lamina propria. Within the lamina propria may find occupied by this particular lymph nodes which is present in here. These are the lymph nodes or lymphoid aggregates, just like malt structure we have this particular lymphoid aggregates over there. And this particular muscularis mucosae, you see that traces of muscularis mucosae there or not there is discontinuous, no, may not have it. Then subserous serous layer, tough dense blood vessels and collections of this particular different fatty or collagen fibers are there. Then we have this muscle layer, longitudinal circular layer, and this outer layer. It should be looking like this schematically, not easy to find. Many of these particular slides are there which is basically focusing in this particular layer only. So, up to this is visible, many of these are not visible as well, but the hallmark is that it have got 4 coats but not having any kind of projections or villi are absent. So, absence of villi, that is a hallmark. First thing, 4 layers you have to mention, like say mucus, submucosa, muscle and the serous layer, and this particular lamina propria occupied by this lymph node collections, right. So, pictorial views or microscopic view should be looking like this. This is like a lumen, and this particular layer is lamina. Mucosal layer having this particular glands going down, and these are the lymphoid collections. As you can see, it is going down to this particular limitless region which is like a submucous layer. Then you have the muscle layer, then which is subserous layer or serous layer which is present in it. So, this is how it should be looking like. So, we are just having 2 of the slides are there, 2 of them, one of them are really good, like you can see the layers and lymph nodes very visible. Other one you need to just like reflect well to understand this particular microanatomy of this appendix. So, to summarize the thing, we are going to see this particular 4 coats of layer of this particular tissue, which is going to be intestine, and this particular intestinal tissues do not have any kind of villi are there. So, absence of villi is the thing that we are going to notice. Then we have this particular mucosa which having got like a glandular thing, and within this particular mucosa we have a collection of lymphoid nodes which is present in it. and then we have this particular like a submucous coat. Submucous coat not having any glands or any kind of like lymph nodes may not be there. If it is there, it should be coming down from the lamina propria itself, and muscle layer which is present. So, go and check yourself the identifying feature, and this particular thing comes as a short note for your examination. So, in your examination in theory as well, you may have to draw and outline this in examination, theory examinations also, like draw a histological feature of vermiform appendix with appropriate pointing or appropriate identification, right.